All right, it's 6:01, so we'll go ahead and get started. We know some people will probably join partway through, but we want to make sure that we get started on time so we have plenty of time for Q&A after our panelists speak. I'm going to turn it over to Susan Krallman to introduce our conversation this evening.
All right, thank you. Good evening, everyone, and welcome. I appreciate all of you joining us, and I'm pleased that we have 7 panelists that will present tonight. I'm Susan Krallman. I'm the director of Blue Mountain Community College's Milton Freewater Center. I'm also a member of the Educational Attainment Alliance, and I appreciate them for making this roundtable discussion possible. They serve all of the Walla Walla Valley, which includes Milton Freewater, and not surprisingly, they're all about educational attainment. I know that this is a really challenging and tough and stressful time for everyone, but I think it's especially challenging for parents who have children in the K-12 system, and knowing that at least in Milton Freewater, we will be returning to distance learning this fall. But we are here tonight to share information, to ask questions, and to problem solve. It's nothing that we can accomplish within 90 minutes, but we have to converse and have conversations first. So again, I thank you for being here, your presence, your participation, and with that, I'll turn this back over to Jacqueline. Thank you.
Thanks, Susan. I am Jacqueline, and I help facilitate the work of the Educational Attainment Alliance, and we are hosting these community roundtable events in 4 conversations across, in 4 places across our region as a result of a conversation that we had with Educational Attainment Alliance leadership. And I'm gonna go ahead and share my screen so that you all can see kind of this central question that we're working with here tonight. All right, so hopefully you can see that there. We are here tonight to ask how the community of Milton Freewater can support children, students, and families this fall. And the conversation we had with our leadership was really, it was that question: how can, in the face of so much uncertainty, our communities come together to support our students, our families in distance learning, in employment challenges, as COVID-19 continues to affect the community. So we know, as Susan said, that we're not going to be able to solve these problems in a 90-minute conversation, but we do view this conversation as an important first step towards identifying possible solutions. And I want to thank all of our panelists who are here tonight. I will introduce them in a moment. I want to thank them for being here, and I want to acknowledge a couple of things. I want to acknowledge, first of all, that everyone on this call has a really tough job under ordinary circumstances, and these are not ordinary circumstances. So the panelists who are here tonight are here. They've agreed to be here even as there's so much uncertainty. You know, one of them said before everyone jumped on, I wish I had more answers. We all wish we had more answers, and I really want to thank our panelists for being here even in the uncertainty of this moment, and being here with you to share what the answers that they do have, and to sit with the uncertainty around the answers we don't have yet. I also want to acknowledge that our participants this evening, or our panelists this evening, are individuals, and many of them are representing much larger sectors and institutions, and it's impossible for them to capture every perspective. So they are bringing their perspective on behalf of a larger entity or organization, and I want to just acknowledge that they can't capture every single perspective. I want to give a couple housekeeping reminders about our format tonight. So first of all, you've likely noticed that this doesn't look like a normal Zoom meeting. If you are using Zoom frequently, you know that typically everyone's face shows, you can all see yourselves. And tonight's presentation is using the webinar software. So you will be able to see speakers, and occasionally you will see speakers' screens, but you won't see yourself. You are also muted. You are muted when you came in, and you will remain muted through the conversation to minimize interruptions. But you will be able to use the question and answer function at the bottom of your screen to submit questions. That's in lieu of a chat box. So if you've been in Zoom meetings, you may have seen before the chat. Chat is disabled this evening, but the question and answer box is fully functional. You can type questions, comments in there. We will see them, and I do have a co-host here on the back end who is reading through those questions and will share them with me so I can share them with panelists after the panelists have spoken. So in terms of format tonight, we will hear first from our panelists, and then we will move into question and answer. But before we do that, I want to just also acknowledge all of you who are here as participants. We have a limited number of panelists because we have a limited amount of time, but each of you brings a really incredibly important perspective to this conversation, and you hold a piece of this puzzle. So you will certainly be a part of the solution, and we want to thank you both for being here and for all of the work that you're doing in your personal and professional lives to deal with this very complex situation we find ourselves in. So with that, I want to introduce our panelists this evening. We will hear first from Superintendent Aaron Duff. Aaron Duff works for the Milton Freewater Public Schools, and he will share with us a little bit about the school's reopening plan and the various contingencies around that. Then we will hear from Joseph Fiumara, who is the Director of Umatilla County Public Health. We'll hear from Toby Sass, who works for Child Care Resource and Referral. We'll hear from Commissioner John Schaefer of Umatilla County about what local government's approach is. We'll hear from Rosanna Lugo, who works for North Slope Management. Rosanna will give us kind of a business perspective on this situation. And then we'll hear from Michaela Cathy, who's the Executive Director at Lifeways, about some of the mental health challenges that are present. So I'm going to stop my screen share with that, and I'm going to turn us over to Superintendent Duff. Superintendent Duff, you're muted. I'm going to unmute you. Classic Zoom.
Classic Zoom, and I started sharing my screen before I unmuted myself, and that's what happened there. I love Zoom. Usually the last statewide superintendent meeting I was on, or one of them that I was on, I came up with a Donald Duck voice. It was very nice that 198 of my colleagues didn't say anything until I was 2 minutes into a rant. So let's just start with that. My name's Aaron Duff. I've lived in Milton Freewater over 15 years and have worked in the district for over 15 years. I have three kids that are in the district, so I feel a lot of the pain that's going on in Milton Freewater right now. I'm also at my office right now because I don't have very good internet at my house. So a lot of the things that we're all struggling with. And I wanted to talk tonight, you know, I wish that I did have a lot more answers to questions that folks have, but I'm going to tell you what I know, and then I'll tell you if I think I'm guessing on something. Everything I'm going to share tonight is pretty much on our website. We pushed out a lot of information last Friday for parents as far as schedules and things like that. And then if you have individual questions about your child or concerns, I would really point you towards the building principals. They're in buildings, they're working every day. You can email them 24 hours. They're not going to, hopefully they don't respond back to you at 2 in the morning, but please engage with us. We want to answer a question if we have it. And if we don't have the answer to the question, we want to know that so that we can hopefully get the answer. So I wanted to give a little timeline of how we got here. And that really started March 12th for schools. Seems like so long ago. This was just about 2 weeks before spring break, and that's when the state mandate came out that we were temporarily shutting down schools. The governor of Oregon shut down schools. And what we thought at the education level was, well, spring break's at the end of the month, we'll be back by April. And then as that moved along, it was very clear to see that that was not going to be the case. To the point that April 8th, the governor ordered all schools to start distance learning the rest of the year. And we started just that next day, making plans and organizing that. I would also preface that last spring was a quick turnaround. That was a lot of work by a lot of great professionals. And I know that there are a lot of things that I would do differently. And a lot of those we are pushing towards this fall and how we're going to open this fall differently. Last spring was a little bit crazy, as we can all attest to. So the next thing I want to let you know about is almost every Tuesday since that point on, school superintendents have gotten updates. And that's ODE guidance is almost changed every week. So for instance, in between one week and another, there were 64 items that changed. And Joseph is nodding down at the bottom because his staff has been, helping us just, I can't say enough for Umatilla County Health has helped us through the process, because what we're talking about is the difference in between having every student into the school. Well, you can have a couple students in the school. Well, you have to have a square footage. Well, you have to have a mask. Well, you have to have this. They were not simple changes. They were major changes that we ended up rewriting the book. We lost track at 12 times. And so we went out at a different way. August 11th, we got a new matrix that was released, and that's really dictating how schools all over Oregon are opening or not opening. And I'm going to show you what the matrix looks like, especially for Milton Freewater. And then August 17th, so just yesterday, we submitted our blueprint that was approved by Umatilla County Health to Oregon Department of Education. And what that does is that gives ODE and the community, because that's also up on our website, what school's going to look like for us. And ours is based on when we return, or a hybrid model. So I said we gave up after about the 12th time trying to rewrite the book. And we decided, you know what, it sounds like to us that we're going to have different stages of returning. And so the first stage is really where we're living in right now. Because by our county, we're not by the county, but the state has mandated that Umatilla County is at a baseline stage right now. And so really what that means is we're supposed to be doing as much work as we can from home in order to slow the spread of this virus, so that then we can be back in school and be back in our workplaces. And so what that means is we're going to be K through 12 and distance education. And then as we move through these stages, you'll see that at stage 3, K3 will be able to come into the buildings. 412 at that point would still be online learning. The other thing I want to recognize through this is we know that one model isn't going to fit for everybody. We know that we have, and since I've been in education, we've always had students that had needs that needed to stay home for various reasons. Students going through cancer, things like that. And so we know that we will have students throughout all these stages that will need to stay home. And so that's fine. We can work through that. We also have parents that want to send their kids to school. So when we're allowed to through the matrix, that's what we'll be able to do. And so we built this model, which is on our website and has been sent home, all the way to fully returning to school. The matrix I'm talking about is right here, and I updated it just this morning at about 10:30 when it was updated. And the numbers are as of August 15th, and it gets updated about every Tuesday. So folks, in Umatilla County, we have to have less than 10 cases for the last 7 days, and we have to maintain that for 3 consecutive weeks. We also have to have a county positive test rate under 5% for 7 days and 3 consecutive weeks. This is where we're sitting. So I can tell you right now, we're not going to have kids in buildings for at least 3 weeks. Now, I will say these numbers have dropped. They're going down, and I commend John Schaefer, the rest of the commissioners, Joseph, doing a good job of trying to get the word out and trying to lower the cases and people wearing masks. But these are a large percent. It's going to take us a while to get these down to where the state allows us to bring students back into school. And so that's why we're spending so much time on online learning and ways to go through that. You'll see when we hit below 30 cases and below 5% that we'll be able to allow K through 3 to come in, because ODE sees the need, especially for K3 to come into buildings. Okay, I'm gonna, just for time's sake, I'm gonna skip that slide because it's up on our website. This is just these are also up on the websites. These are examples of the schedule. I talk about last spring to now, we learned a lot of things. So for instance, everything's going to be recorded. It'll be available. So if you're like a parent like me that doesn't get home until 5:30, 6 o'clock, and I'm sitting down with my second grader, I'll be able to hopefully help them through that process. We're also offering at the K5 2 sessions a day. So you'll see here, there's a math session from 7:40 to 8, and then another one, the same session, but just depending on student schedule or parent schedule, from 1:10 to 1:40. Another thing we're working on is availability of tutors or adult helpers until 7 o'clock at night, so that parents like me, I needed help last year with things. So if you need help with that, or if students need help with that. When you look at the, this is also K-5, so very similar schedule. We heard that from parents as well, trying to make things similar. When you look at the 6-12 format next year, we're going to go into block schedule for this year. So Mondays, 1st through 4th period, they're going to be from 8 to 11:10. And then those classes again on Wednesday. That gives students more time to do that work, ask questions on the Tuesday, to be able to go back to here, because I've got a 6th grader next year. I'm going to have a lot of questions in the evening. You'll notice on both these schedules, there's areas that we have let parents know teachers are not going to be available. They need to eat lunch. We're humans. But then there's office hours available every day, lots of office hour time. And that is when teachers will be engaging with students, but also parents can engage with students. I also bring up, you can always email the teacher, and they can get back to you that day or the next day. They're probably not going to get back to you in the evening, because they're probably working with their own child. But that's part of why we're doing what we're doing here, giving more time. We also recognize that kids should not be in front of a screen all day long. And that's why you don't see an 8 o'clock to 3 o'clock screen time here. So some barriers and solutions that we've identified, and we identified these through surveys with parents, surveys with students, surveys with staff, technology, of course. And so we're going to be doing a Chromebook checkout. Look for that information up on our website this week. We are a lucky district in that the last few years we've been 1-to-1. So we last spring were able to check out as many Chromebooks as needed, and we'll be able to do that again this fall. One of the barriers we have is internet. And so there are low income waivers available from some internet providers. And we have documents at our offices if you need to prove for low income needs that they have. We've also ordered hotspots that'll be available. But then we've also got students that we know live in areas that don't have internet and don't have cell phone service. That'd be my kids, don't have cell phone service at my house. So we're trying to come up with new ways of doing things. And one of the things that we saw in other areas of the nation was flash drives. We'll have bus drivers that'll do a daily route and drop off and pick up flash drives. And I know that doesn't sound like a good use of resources, but to me it is, because at least we're going to get something to kids each day. Maybe parents are coming into town, maybe they're not, but we want to try to do the best we can do. Childcare is going to be the other big barrier. We know that. I know that. I got 3 kids and I've needed childcare since March. So we're trying to team up with organizations like a YMCA to provide childcare K through 5. We're working through those situations, and hopefully I'll have an update for the community in the next week on that. And welcome any other organization that would like to help with that, because that is a need in Milton Freewater, whether we've got COVID or not. Mental health, we deployed our counselors last year for students and parents. As a parent, needed some counseling, and will again this fall. And we'll do that again. And part of that is daily check-ins with staff, doing as much as we can with that. We have purchased and acquired student and staff custom masks. We have student and staff N95 masks. We have student and staff face shields. We have the buffs. We have literally 50-gallon drums of hand sanitizer. About 3 years ago, we actually purchased sanitizer fogging machines like they use at a hospital, and we've been using those for 3 or 4 years and seen results during the cold season, and we've actually purchased more of those, so getting ready for that. And then that blueprint that I talked about with ODE has a lot of entry procedures, staff procedures, students and visitor procedures, so trying to be as safe as we can. Then the final thing I'd bring up is food. We served since March, since we've been shut down, we've served meals every day. And we'll continue to serve meals every day, similar to what we did in the spring, where we'll have a couple campuses that parents or students could walk up to. And then we will also have a lunch bus and a Suburban that will make routes throughout the community for that. So we have food, we have it available. So want to make sure that's available to students. Jacqueline, I think I took more of my time there. And I just remembered I talked really fast, and I apologize. But that's what I've got.
We gave you limited time and then we told you to talk slowly. So that's a tough combination. The reason Aaron is referencing the rate at which we are speaking is because we do have interpretation running. And I'm sorry I forgot to announce that in my welcome. If you would like to access Spanish interpretation, it is available there at the bottom of your screen. There's a little globe image and it says interpretation. You can click on that button and it will allow you to access live Spanish interpretation. So with that said, I want to thank Superintendent Duff, and I'm going to turn things over to Joe Fiamara. All
right, good evening. I will take probably a little less time than Aaron did going through everything. We at UCO Health have also been impressed, not only with Milton Freewater, but really all of our school districts putting a lot of thought into their plans. These are plans that the requirements have changed very much, very often, and they have had to scramble each and every time to bring these up. And they have been extremely creative with how they have put some of these plans together to try to get education to the kids. Now, I personally believe kids should be in school. Like, that is the goal we need to get to. That being said, I do want to comment, kind of one silver lining, if you will, with the way the school program is going to unfold this year due to our high rates. Some of the requirements when you have in-person school can very quickly shut it down and force significant changes once the kids just start to get into a routine and suddenly be slammed right back to online learning. We at least are not going to have that for a while. Obviously, we want to get kids in the school. That's the goal. Those metrics Aaron mentioned, we've really got to get down to about 20, I think it's about 24 cases in the course of a week for our population of our county, for that to be able to, even at the K through 3. And that's something we've been working on really for the beginning from us. We've always been trying to keep this down. Our main role in this is education and advisement for the school districts. There's a common misconception that we are approving everything they do or not allowing them to operate, and that's not the case. We're held to the same requirements they are. We just have a little bit more knowledge in some of the health aspects, and we are there to help apply what they're trying to do in a safe way, and so that there can be some level of confidence in the plans they put together and that run through our office and get our sign off. Our big role is case investigation, contact tracing, and really doing follow-up. All of that continues as the school year gets going, and we're doing everything we can to get the word out, to get things traced, to get people notified, to get this pandemic, this virus tamped down enough so that we can get kids back into school. I do want to call out, a couple of my staff have been working very closely with, specifically Alicia has been working with a lot of the school districts, and that is something that will continue to happen, and assisting these schools in any way we can is going to be a priority for us moving forward. And with that, I don't have a whole lot else to add at the moment, unless folks have some questions.
We do have a couple questions we'd love to share with County Health, but I'll save them for the end of panelist remarks. But thank you so much. I'm going to turn things over to Toby Sass with Child Care Resource and Referral.
Hopefully I can share my screen. I think I have it working. So my name is Toby Sass. I'm with Child Care Resource and Referral. I was able to get my PDF to work versus my PowerPoint. So since March, about mid-March, the state of Oregon, the Early Learning Division had closed regular childcare, and they had offered emergency childcare to be available for essential workers. It has progressed to provide care for families that are returning to work. So emergency child care providers must apply for and be approved for emergency child care. Many of the providers in our area across Eastern Oregon, only 41% open back up. So they had to prioritize individuals of the essential workforce, limit the number to stable groups of 10 or less, adhere to the safety guidelines, which new guidelines came out on Friday. And then it says that they had approved over 2,000 across the state to serve children. The new guidance that came out covers all licensed programs, including certified centers, certified family, and registered family. Exempt child care providers can provide child care for 3 children or less, and they're not under this guidance. All child care and preschool provided in public school settings are under the new guidance. All recorded programs, including school age, OPK, relief nurseries, early intervention. And like it says, it does not apply to friends, family, or neighbor care or regulated subsidy. There's ways to find childcare. They can dial 211. It has the text information right there. Or they can do an online search to Find Childcare Oregon, which is the TRI link right there. And they can see who's providing childcare. My staff have been working diligently to help programs that had closed during COVID to reopen to serve children, and they are working to help licensing get new programs. We just opened supported a provider in Milton Freewater that just opened within the last week. And then we have a couple more providers. We're hoping it usually takes about 45 days to get them going. Licensing is out, providing some one-on-one visits, depending on the situations. Most of them are virtual, but if there's a health and safety concern or something they need to go out, they will go out there and visit. Other than that, they are virtual. There is employment-related childcare. They did reduce the copays to 0 for families that qualify, and they did increase the amount families can make for a family of 4. It is $4,000 a month. There is guidance on the DHS website, but it is a 0 copay to help pay for childcare up to the next 12 months. And then here's my contact information. Is anybody that's providing childcare that wants to become licensed or find out more, they can contact my staff member, Jennifer, and there's her phone number. And then they want to know more about childcare licensing. It's under OregonEarlyLearning.com and COVID. We are working with those facilities that have closed. Some may stay closed because they have school-age children. We're trying to support them and possibly opening just to provide care for school-age children during that time so they can homeschool their child with the guidance from the school district. We do have inclusive partners that works with families and providers for special needs that we send them to them for support, and then they help provide that additional support. And I think that's all I have. Mine was kind of short and sweet. Anybody has any questions, I'm here to answer any of that.
Thank you so much, Toby. All right, Commissioner Schaefer will share with us next a little bit about what Umatilla County is doing. Commissioner Schaefer is calling in by phone, so you won't see his video, but he is here with us and ready to share.
Actually, I think I turned my camera back on, so I'm not sure if you could see me now or not. So,
hello.
Hello. Again, I apologize for being on the road. I was planning on being home, but construction got me. If it hadn't been for construction, I'd been there. So I kind of want to echo what everybody else has already said. First of all, as you already know, we're still in baseline, and I'm supposed to get a phone call either tonight or tomorrow morning from the Oregon Health Authority Director, Pat Allen. And at that phone call, we're going to find out if we get to go back to phase 1, hopefully phase 2 on Friday. My guess is phase 1, even though we've put in a request to go to phase 2. But what that means is the biggest thing is restaurants would open back up. It'll really help our small businesses and that kind of, and the business that had to close. It'll really help those businesses out. Another big issue, obviously, is childcare. We just heard about that. Umatilla County is a big employer as well. So one of the challenges that we have is when when our employees, their kids are still in school, and they need to help assist the kids. So they're looking for time off to go and help with that. So that's a challenge that we're dealing with as well. Obviously, broadband internet, like I heard from Aaron Duff, that's a big, huge issue all over the county, not just in the Milton Freewater area, but like outlying areas, Ukiah, a lot of those different areas. That's a big one. Probably the biggest challenge that we have is moving targets. You know, one day it's and I think Aaron articulated it very clearly. You know, you have a set of guidelines that you're supposed to meet, and then a couple weeks later they change those guidelines on you. So, and that's not just in the education world, that's in a lot of different fields. So we're seeing a lot of struggles with that as well. And you know, on a weekly basis, we meet with different state legislators and county commissioners. And one of the things that we were trying to get was opening up schools by zip codes. So that was one of the big things that we were hoping for, you know, in case, yeah, maybe the whole county looks, you know, the numbers aren't where they need to be to open up. But what if you're a school like Ukiah, clear out on the south end of our county with 0 cases? Couldn't we open something like Ukiah up? And that's what started those conversations to allow some of the smaller and frontier counties to open up their schools, even though their counties might not meet the metrics that Aaron was talking about. Another challenge is for the children that are not in school, we don't have eyes on those kids. So in some cases, it's more safe for the child to be in school than to be at home. And food insecurity plays a big role in that. So that's another issue that we're looking at as well. And mental health is huge. One of the things we're seeing is mental health cases are starting to spike. And I don't want to walk on Michaela Cathy's, steal her thunder by any chance. But those are the things that we're dealing with at a county level.
Thank you so much, Commissioner Schaefer, and thanks for being willing to join from the road. We really appreciate your flexibility. With that, I'm going to turn us over to Rosanna Lugo, and she will give us a little bit of perspective from kind of an employer's, looking at things from an employer's perspective.
Good evening. My name is Rosanna Lugo, and I'm representing a business, as Jacqueline stated. I'm actually you're actually going to see Sadie's face here shortly. That's my boss, and one of the things that we really, or she has really tried very hard, is to ensure that the employees are fully supported. And I think from the beginning of this unfortunate pandemic that we all went through, and especially when we started hearing that the schools were closing and childcare providers were closing, that was the biggest red flag that we had to ensure that we could sustain our workforce. What do we need to do as an employer to make sure that there's flexibility built in for those families, especially all of the school-age families, which the majority of our workforce is. They have a lot of children that are either in daycare or preschool, so all the way up to high school. And so one of the things that we've been trying to continue to do is, as we speak to our employees, not only about the flexibility being built in, but also safety, and that we want to make sure that they stay safe so they come back so we can get our work done each and every day. And so we ensure that during our safety meetings that we speak about what's been up to date. As you stated earlier, changes occur on a constant basis. Today I attended a Zoom meeting that talked about what are some of those guidelines that we need to ensure as an employer during harvest and crush, which is coming up right up, on our heels. And how do we ensure that we sustain our employees safe and keep them healthy? And what are all those guidelines and steps that we're going to need? So I was bombarded for about 2 hours, a whole bunch of new information. And it's like, oh my gosh, how do I, wait a minute, slow down, is what I'm wanting to tell them. But it's really important that as employees, they know that they have the support of the employer. They know that they have the flexibility built in. When schools start up, how do they make sure that they can build in, as Superintendent Duff stated, the time to help their child? And if it's during the day, one of the things that Sadie really emphasizes is if they need to take time off, it's okay. I think one of the scariest things as an employee is, oh my gosh, I'm taking too much time off, I'm going to lose my job, they're going to fire me. And then what am I going to do? And right now with employers really trying to stay true to the current workforce that they have and not hiring any new ones, that's the other frightening thing for these employees. If I lose my job, where am I going to find another one? We're hearing employers that are not going to pick this year. That's huge. That workforce is not going to have a job. They're going to bring in machines to do all of the picking. That's scary. So employees are asking, oh my gosh, am I going to have a job during harvest? That's the other thing we're trying to ensure, is to keep them up to date and reassure them that they will have a job, even though they have to take time off, even though they have to take care of a loved one, even though they are having to stay and go to all of these, if they have to attend a meeting for their school as an orientation, make sure they have that support from our end that allows them to comfortably attend and know that they'll have a job to come back to. We unfortunately this year had one of our employees passed away due to COVID in May, and it was quite a shock, and it was an eye-opener for all of our employees. You hear all the rumors about what this virus does and what this virus doesn't do and who it affects and who it doesn't affect. And so when people tend to take it lightly and then they finally come home and they see the reality of this virus, they now are taking extra steps, as we are, to make sure that they stay safe and healthy. And that's been our priority. How do we keep our employees safe, and how do we keep them healthy so that when they can go home, be with their families, and come back to us the next day? Our challenges are just that, making sure that education is available for these students at different times. And I'm really glad Superintendent Duffy talked about how you're going to be recording these and having these lessons available for families, parents, to be able to view, to watch, to see what's happening. That's huge. I'll be able to speak to that tomorrow when I meet with the staff to tell them about what kind of, the summary of today's meeting. That was huge. The other thing that I really appreciated was that the child care providers are they're ramping that back up and making sure that the availability is there. And how do we communicate that out to our employees so that they can start trying to identify, where can I get my child in? Those have been the challenges. We have really worked diligently with a lot of community resources. When we had our first case, unfortunately, 7 additional employees had to be quarantined. Thank goodness none of them, they all came back negative, but they still had to be self-quarantined. And one of the scary things is that's a loss of money. If they use their sick leave earlier in the year, how am I going to now cover my costs now? And one of the things that Sadie did is she connected with another winery owner who was able to raise funds to help these families not lose any income. The employees work anywhere between 9 to 10 hours a day, but we were able to cover the cost of 8 hours a day, every day for the 2 weeks they were out. That was huge. Some of these are single parents, head of household, single mother with 4 children, and panicking. I got to go to work, but you can't. But so how did we help that? And we did. It was huge to have that as a huge relief for those families, to know that they were going to continue to have some type of income coming in to help them during the 2 weeks that they had to be off work because of this pandemic. We have received support from Oregon Farm Bureau, and I think that's huge for employers to know. There are resources out there that'll help get them hand sanitizers, help them get them masks. We were able to get 500 additional masks from Oregon Farm Bureau because being essential workers, that's critical. If we don't have the essential workers picking and harvesting or pruning, we're not going to get those grapes off those vines. Not only do we lose, but they lose, and then the wineries lose, because then you don't have any wine. And I like wine. I got to tell you that too. So that's been huge. What resources? We've also worked with our insurance, SAFE, to get reimbursement on sanitation supplies. So what we weren't able to get from other resources and we've had to purchase, our insurance has been able to come back around and help us get the funding back into the business so we can continue to budget out for the rest of the year. We are currently working on trying to ensure that we have protocols in place for harvest. Like I said, that's right around the corner. And after attending today's meeting, I've got some work to do to be able to ensure that we have everything in place, have all the posters that are required through OSHA and ODA posted both in English and in Spanish, making sure that I am providing information not only on site, but at home. If I get any alerts through my phone or on the website, immediately one of the things that I do is I text those the employees that are able to receive texts, and if not, I'm calling them on the phone, and they know that. And I'll call them in the evening, or I'll call them early morning before they have to be here. Harvest is going to, the people start at 3, 4 o'clock in the morning, and they're looking at me and they're like, "Lady, are you going to come in at that time?" No, I'll call you, but I'm not coming in at that time. So those are the other things that we've been trying to do, is making sure that we stay up to date with all of the OSHA requirement changes, all of the resources that are out there. We've been able to help employees that have tested positive through the CARES Act, and making sure that we cover their costs through that. So really, and I think that's important for employers, is making sure that you have an officer on site to make sure that they're up to date with all the changes in the rules, making sure that the employees are adhering to wearing their face masks, wearing their goggles, hand sanitizing, hand washing. And that's the other thing that we're going to be implementing. We've added additional portables. We've added additional hand washing sites. We'll be cleaning those constantly. So that is another thing we've been doing. I think one of the other things that I'd say, and just to wrap up, because I know I talk forever, a resource that we would like to have is more education on the virus, and having it posted, in places around the community, grocery stores, clinics, that talk about and help them understand that by wearing a mask, it's going to help save lives. No matter how small or insignificant they think it is, it's huge. So education. I'll wrap it up with that.
Thank you, Rosanna. All right, Michaela Cathy from Lifeways is going to finish the panelist remarks by talking a little bit about mental health and some of the concerns related to COVID.
Thank you. Good evening, Michaela Cathy. I'm the Executive Director for Lifeways, the community mental health provider in Umatilla County. When I was asked to do this and I took a look at some of the questions to be addressed, I was a little overwhelmed, because behavioral health as a whole, mental health and substance use, are such a complex topic to fit into only a few minutes. And adding into the complexity of those areas, already having a pandemic and what comes along with that, makes it even more challenging. So I recognize that I'm going to only be able to cover the surface level here, but hopefully the resources that I'll provide will provide you an opportunity to reach out if something for you personally you're needing more information on. So mental health and behavioral health are really about addressing the whole person. And during this time, that whole person is impacted by financial constraints, the stress of the school environment and what that's going to look like, balancing childcare while we're trying to work if you are still able to maintain employment, and then sometimes having to do all of that within the same environment. So I imagine regularly having a child right next to me while I'm trying to do my meetings and they're trying to do their schooling, and my dogs are enough of a distraction, so I can't imagine how challenging that would be. And many of our families are facing that right now, amongst much more complex challenges for their families. So when we look at the pandemic and we look at what that impact is for behavioral health, really I would just sum it up as it's a huge increase in stress. And stress does horrible things to the human body. Stress can lead to fear and concern about your own health. It can change your sleeping and your eating patterns. It can cause difficulty with concentration. It can cause difficulty with interpersonal relationships. If you have chronic health issues, it can worsen those. If you're already vulnerable and then you're exposed to something like COVID, you're at an even higher risk for the potential outcomes that can come with that. If you have pre-existing mental health conditions, stress is going to potentially worsen those. It can also potentially lead to increased tobacco and alcohol or other substance use. So those are all huge concerns, and they all add up together to make the picture a little bit more challenging. So as Commissioner Schaefer referenced, we are seeing a significant increase in mental health and substance use needs right now. And what we're trying to do to address that is that, one, we have to balance our workforce as well. We have to make sure that our workforce is maintaining safety, that they are balancing their lives as well, and that we're being as supportive as we can be to them to make sure that they can meet all of those same challenges for their families while keeping services accessible. So we have gone to primarily telehealth model, and we have a lot of resources around that to combat if there's challenging internet connections or you don't have a computer or a tablet. One of the platforms that we're utilizing is completely confidential, so it is HIPAA compliant and make sure that your information isn't going to get out. It's not like the challenges we saw with I believe it was either Zoom or Skype early on in the pandemic, where there were some breaches in confidentiality. The platforms that we utilize have been fully vetted by our compliance officer to ensure that we can do phone conversations. We've met families on their front porches. We've met in a park, anywhere that we can mitigate some of those risks and meet the needs of the individuals that we're serving. So we, like I said, are primarily telehealth at this point in time. However, we are doing in-person services when it is clinically appropriate for that. We have screening protocols in place for our staff coming into the office. So doing symptom check, temperature checks. We are requiring masking in all of our offices, and we have regular sanitation happening throughout our facilities during the day. We have the same screening procedures in place for clients coming into the office as well. We have closed our lobbies, but that doesn't mean that we have closed our offices. It just means that we ask for a telephone call when you are coming in. We'll come greet you in the parking lot, do a quick series of questions with you, check your temperature, and then escort you into your appointment to make sure that you're minimizing potential contact with other individuals. We will maintain those protocols as long as we need to, and we'll shift and ebb and flow as our county adjusts with our phases, and we'll increase in-person services as much as we can at a safe rate. We are also looking at our access hours. So telehealth provides a really amazing opportunity for flexibility with the time that we can serve you. Where we are sometimes limited by staffing the office during certain hours and making sure that we have the appropriate people there and we're balancing work life, etc. Telehealth provides an opportunity to serve outside of normal business hours. So we're in the process of formatting some different schedule options for our clinicians and our staff to work within that will open telehealth up into early morning, late evening hours, and eventually looking at weekend hours as well for that. And that is not pandemic withstanding. That will be long-term changes that we'll be looking to make. And then I just realized I neglected to share my screen with resources, and I do believe these will be sent out after today's discussion, so you will have an opportunity to capture them. But just really quickly, Umatilla County Human Services is available for all of your substance use needs. They also have an amazing peer support program that works very closely with our peer support program as well. The David Romprey Warm Line is a peer-to-peer opportunity to just call and talk to someone if you're needing not necessarily to get into services, but you just want to have that friendly voice to talk to for a few moments. Obviously, the National Suicide Hotline. We also have the Oregon Youth Line, and teens have the opportunity to text or to call on that one. Lifeway's crisis services are open 24 hours a day, 7 days a week, 365 days a year. Phone number is there. And then abuse is something that we also are looking at in this time. There aren't always eyes on in as many opportunities. People are confined in their homes. That can lead to, again, stress aggravating interpersonal relationships. So if you're concerned about adult abuse, you can report that through Lifeways. We work with the state on investigating those situations. That number is there. DHS for child abuse reporting, that number is there. And then domestic violence services is also available throughout the county. So again, surface level, but what I got in today's time. Thank you.
Thank you so much, Michaela. I'm going to have you, oh, you just did it for me. I was going to say stop sharing your screen. Thank you so much. All right, so we have about 45 minutes left in our time for question and answers, and I have seen some questions come in live. And we will preference those, and then once we've gotten through questions that have come in live, we'll move to some questions that we got at registration. And we are happy to continue taking questions live. So if, as panelists were speaking, you had questions, or as questions get answered, you have more questions, please feel free to use that little question and answer box at the bottom of your screen. It should be in your toolbar, and you can type questions in for any of the panelists, and we will try our very best to get to those. So Commissioner Schaefer, our first question is for you. We would love it if you could please elaborate on what the county is doing to expand access to broadband, and also talk a little bit about whether there's traction at the state level to get COVID metrics by zip code so that schools in areas with a very low number of cases can go back.
Okay, so I'm going to start with the first question, broadband internet. One of the things that we're using CARES money for is we're trying to come up, and we've been working with, especially at the federal level, both Senators Wyden and Merkley, along with Representative Walden, are really working at trying to get better access to broadband internet. Actually, just yesterday, I was on a Zoom call with Senator Wyden, and I brought up the broadband internet issue again with him, and saying as long as our kids are going to be having to be distance learning, we need to get them internet access. And he completely agreed with that 100%. So that I can't make any promises, but the federal level, they are working at that. They do hear us here at the local level. And the second question, refresh my memory on that one.
The second question has to do with whether there's traction at the state level to move to evaluating by zip code as opposed to by county. And Superintendent Duff also offered to jump in with that one. So if you want to take a stab at it, and then I can turn it over to Superintendent Duff if you miss anything.
Well, so that was the first step we did, was by zip code. And then they kind of did a modified version of that. And that's kind of where we are now. And actually, probably Aaron Duff is going to have better information on that one than I would.
Sure. Why don't we then turn it over to Superintendent Duff? Thank you, Commissioner Schaefer, for filling us in on broadband.
Thank you.
John's right. It did start out, we asked about the zip code, and what was brought up is that, especially in our area in Eastern Oregon, really Ukiah is probably the only district that is not affected by this issue, in that a certain majority of students could live in a different zip code and go to that school. So we have students that live in Milton Freewater but attend in Athena, that attend in Helix, and vice versa. So you'd have to go through and figure out ways of getting around that. If the reason why we're not opening, the Milton Freewater or the Hermiston schools, for instance, is because of the high numbers, how could you open Stanfield if a certain percent, more than 10% of their students came from that zip code? So that's partly why the zip code issue, I believe, got probably thrown out. They went to a county-wide matrix. And then there are some waivers for, like John's wording of the frontier school districts that are truly out by themselves, and looking at that. So.
And I'm just going to chime in here because I was on a committee, if you will, with some staff from IMESD as well as Senator Hansel, where we were trying to make zip codes the deciding factor on that. And it sounds like Aaron may have received a much better answer than we did for why it couldn't happen, because we never really got a good answer on that.
I got about 60 pages of an answer, Joseph.
So just to clarify, I want to just directly address the fact that currently the reason we're going by county, or the reason that Milton Freewater schools can't open, even though cases are lower in Milton Freewater than perhaps elsewhere in the county, is because we are going by county numbers right now.
That's how the state's looking at it. And so, yeah, basically.
Yeah, just wanted to give that blanket. Thank you so much. All right, Aaron.
Real quick,
I'm
can
sorry.
I
Go
jump back
ahead,
in
please.
again? I'm so
Please.
sorry. It dawned on me that we keep using these acronyms, ODE, OHA. I just want to make sure everybody knows what we're talking about. OHA is the Oregon Health Authority, and ODE is Oregon Department of Education. I just wanted to make sure that everybody knew what we mean by when we throw those out there.
Thank you so much, Commissioner Schaefer. That's a great reminder. I think all of us who work on these issues day in, day out, we get used to those acronyms and we forget to not use them in these more general conversations. So thank you for that reminder. Aaron, I was about to apologize. The next several questions are school related. So you're up again. You discussed tutors or adult helpers that would potentially be available from 7 a.m. to 7 p.m. Can you talk a little further about that assistance? Is it available virtually, in person, for all ages, or primarily for elementary school? We have attendees who are looking for a little more information on the assistance.
Sure. And just to be clear, I said 7 p.m. I'm not sure if we'll be rolling quite at 7 a.m., but pretty close to that. And this is a little bit of a build it as we go situation, but also something that we got back feedback from parents. So we're building as we go. Unfortunately, we're not able to do any in-person tutoring. So you couldn't drop your kid off or meet at a house or do anything like that. It would be over either like a Google platform or Seesaw platform or a phone. And so we're trying to work on those. Part of it is we're going to see how it goes and see how much staff that really would take in order to do that. And we're going to try to make it as easy as possible. But I would say this, we'll adjust as we need to adjust. And that's what we tried to do last spring. We all know that things ebb and flow. And so we're looking at how to make that adjustment and try to do the best we can do. We're also looking at our own staff of making sure that we're not, I got to take care of my people because they're top-notch professionals. And, but we've got some folks that would rather work in the evening. And so we're going to try to make that available.
Thank you so much. And on that note, Superintendent Duff, what would you ask from the community, from employers, from other agencies and nonprofits? What can we do to support the school and the families whose students are attending the school?
I think some grace is a big deal. I ask that from everybody, that we're all trying to learn how to do this. All of us want to try to do the best that we can do all the time. But we need help in Milton Freewater. On my soapbox for just a second, Jacqueline, I feel like sometimes Milton Freewater is forgotten a little bit, or we're kind of over by Walla Walla. And so I guess that's what I'd ask for. And I know John does a great job of being over here and making sure we're into things. But I think at the state county level, we need help. We're the third largest school district in Umatilla County. We have a large population in Milton Freewater. We have a lot of need in Milton Freewater. And we've got a lot of people, hardworking folks in Milton Freewater, and they're not really asking for a handout. They're working. We heard that tonight. They're out working, and what do I do with my 3 kids while I'm at work? That's me. I'm asking that question. What do I do with my 3 kids? And so, if we're seeing things happening in Pendleton, Hermiston, those areas from outside agencies, we just like those agencies to help, come to Milton Freewater. We'll make it happen. But I think that's a big part of it, the need factor there, and making sure that Milton Freewater, we exist, we're here.
So in terms of some of those other agencies that are coming in, you mentioned earlier that the YMCA is working with Milton Freewater School District, and there are some questions about the details around that program. Are you able to say anything more about that at this point?
I will probably say more than Karen at the YMCA wants me to say, but we have a great relationship. So I will try to answer as much as I can. With that Y program, we're literally building it as we go. And I'm glad Toby's on here because we may need some help with some of the building blocks.
I can certainly help you, Aaron. I have some answers to some of these questions that are sitting here too.
Perfect.
I can support with.
So some of the things we're looking at, I know the state has like Toby kind of shared, there's rules as far as how many students can be a part of each of these, pods or classrooms that could have kids. And so I think the number that I last saw was 10, but I also know that they got an update on Friday, so that might have changed. And so we're gonna try to have a program. It's not going to be big enough for every K-5 kid. I can tell you that right now. But I'm hoping that it's a program that is a low-cost program and open to Milton Freewater families. And I think one of our restrictions will be finding staff to work it. And I think space-wise, I think we have a pretty good area for space. But I think those will be some of the restrictions that we'll be seeing. And a question I've gotten, superintendents, we've been texting almost daily with each other all the time. I'm just going to throw out a question that I've gotten, and I texted with two superintendents right before I got on this. Can you explain to me why I can run a child care facility, but I can't run in school? No, I can't. I can't at all. So I don't know that, but there you go.
Aaron, I can give a state answer for that. In the guidance that they provided for the health and safety that supersedes everything prior, it says that safe and quality childcare and early education is fundamental to the state's recovery efforts and the short and long-term well-being of children and families. So that's the ELD's response to why childcare and not schools that they gave. Is we know parents are stressed, we know families have to work, children have to go somewhere, and if the schools aren't open, at least there's programs that are open that can support them. As far as the answer, the question was how many students can be served in a school age program. The state guidance says no more than 250 children can be served in one program. They did add baseline guidelines. We originally thought that they were going to allow childcare licensing regulations to go back to the 20 children in a center and 30 at school age. They did change that. Baseline is groups of 10 cohort stable groups with an alternating 2 children, kind of like a football team, that if 2 children are missing, they can have 2 extra children fill in those spaces. For phase 1, it would be 20 children. In phase 2, it's up to 30 children for school age programs. So they did adjust those in the regulations for that.
Thank you, Toby and Aaron. There are a couple more kind of practical questions. I know people are eager for details about cost, and then also for who's eligible to attend a program like what the school is working with the YMCA to build out. So would it just be families whose students are enrolled in Milton Freewater schools, or is it students whose parents live in Milton Freewater? Those are some kind of practical questions that are coming in. And I do want to just acknowledge that this is kind of a building the boat as you sail it, or laying the track as you run it, kind of an effort for all of us right now. And if there's more information that's coming out, we're certainly happy to push that out as it becomes available. I know that, the questions are going to be kind of endless.
I'm going to use the analogy of building a plane while you're flying it, because I feel like I've been dropping 30,000 feet every day. So I can't answer the cost to it, but what I can say is that we're trying to work with some grant programs, and YMCA is doing a great job of trying to make it as least cost to families as possible. And I'm not sure who's going to be qualified to be able to go to it, to be honest, either. That may have some things to do with the YMCA and some of the funding sources that we're using for it.
Thank you. So one of the things I will just reiterate is that we will push back a summary of tonight's conversation and then share more information as it becomes available. So if you're registered for tonight's event, we do have your email address and we will share some of those relevant pieces as they become available. Superintendent Duff, I want to send another question your way, and that's about students who may need some extra support. So our special education students who may be learning English as a second language, and that would include Spanish-speaking parents as well, thinking a little bit about what resources are available for some of those populations.
Sure. And so Spanish-speaking parents, each of our schools has interpreters available to take phone calls and talk through those. That's another thing that we're trying to work on with our evening programs, tutoring programs, is to have a couple folks that are bilingual as part of that program. We know that's important. We want to push towards that, and I think that we'll be able to do that in many cases. And for special ed students, and what we're going to be looking at, and if you look at the schedule that's online, K-5 especially, is there are times in there that are, for instance, like RTI times, or kind of intervention times. So in Milton Freewater, every student K through 5 goes to an intervention, and that's based on partially on what you need as far as skill deficit that you may have, or it may be a tag situation. So we're still going to have those opportunities. We will still have special ed opportunities. We're working through some of those. That may involve some added tutoring. It may involve a different curriculum that's used with those. We have great special ed teachers that are going to be working through those programs. So trying to identify those. We've also are working with our ELL students and how to up the game with those situations as well. There's also, as we progress through this, my crystal ball, so I'm guessing here, folks, is that at some point we will be allowed to bring in small groups of students, and those would be the type of students that we'd be targeting first, along with students with connectivity issues would also go on that list, because we know as educators that's where the need is, so that's where we try to target first.
I'll let you drink a sip of water before I toss the next question at you. So kind of two things to follow up on that. Parents are wondering where they can go to learn more about what's expected of them, where they should kind of check in for how best to support their kids. And I'll give you that, and then I'll give you part two.
Okay. So on the websites, there's the schedules. So that's going to be kind of expectations. There's also some messages there from principals. The first week of school, look back at my calendar here. So that really starts, at the end of the month, and then the first weekend of September. That's when teachers are going to be contacting parents. You'll be setting up expectations. Something we also learned from last year, I think I mentioned it already, but some how-to videos. I know I struggled. I may or may not have had a child of my own who, of course, was finishing every assignment as I was told. But then after about 3 weeks of me figuring out on Google Classroom where you can go to assignments, I don't remember how it's worded now, but not turned in or still due, suddenly there's some assignments there that weren't done. So working on some how-tos for parents as well. We heard that loud and clear. We actually had staff in yesterday working on those videos, and those will be available on the website. And we're working on our Chromebook checkout time. And during that Chromebook checkout time, we're also going to be having some tents kind of set up where you can drive through, ask questions. Okay, how do I get onto here? How do I need to log in onto here? The other thing that we're going to be setting up after a Chromebook checkout time, so look for that first week in September, is a meeting much like this with each building. We'll have an evening where they'll have a meeting set up where parents can ask questions and kind of go through those type situations. But we're trying to look forward to teachers contacting you and talking to you about expectations and how things are going to work and communication flows. And I would say as we progress through it this fall, please email your teachers or email principals and make sure you get your answers. We don't want kids or parents to feel like they're not getting answers. If we got them, I'll give them to you, and I'll tell you if I don't have them.
Thank you so much. I'm going to give you part 2, and then I'm going to give you a break, I promise. So the part 2 is people have asked a little bit about attendance, how attendance will be recorded given that students are remote, and then what kind of happens if a student isn't accessing the online platforms in the way that you would hope.
Well, so Oregon Department of Education has told us how we're doing that. So students will attend. Now, attendance does not mean necessarily that they are in on the class lesson. And I'm going to use secondary as the example. I'm going to use a senior for the example because I think that that's really the area I see. So a senior that has a first period class, ODE has said that attendance can be registered as if they did the assignment that day. Now, if you did the assignment at 8 o'clock at night because you're watching 3 of your siblings during the day and that didn't happen, that is going to be acceptable. That's going to work through. So I think it's more of what I would say is a proficiency based attendance, where it doesn't necessarily have to be that during this exact time slot you attended. And that's why we're recording lessons, because we saw a lot of high school juniors and seniors, especially, to be honest, they're working because they can, and in some cases because they need to. And so we're trying to be flexible with them. We understand that for some folks, that's what you got to do. And so that's how that works. So if a student doesn't log in, doesn't attend, according to that, then we'll be contacting students, we'll be contacting parents, and working through those processes. So it's not supposed to be, it's not the hammer coming down. We're just concerned as educators when we don't hear from kids. That's our first piece. Is we get concerned, and then we just want to make sure there's not a problem, and then work through that. It'll be different than it was last spring.
Thank you so much.
Last spring was not we were not taking attendance per se. We will be. And the other question I think that parents should ask is last spring things weren't graded. It was a pass or fail or no pass situation. That's not the case. Oregon Department of Education has said you are going to grade. So this will be graded. So that kind of ups the ante for attendance and getting your assignments done. So if you're a kid in my house, maybe a 6th grader this year, you better get your stuff done. No Xbox time.
Thank you. So I, as promised, we'll give you a break, and I want to ask Joseph a public health question. So Rosanna mentioned in her comments the need for kind of education in the community. And one of our questions is what's being done from a public health perspective to educate folks about COVID-19 and help stop the spread of COVID-19 in our communities?
Sure. So the short answer is we're doing everything we can think of to do. I don't think it's any secret that majority of our cases are on the west side of the county. And so a lot of our time and effort has been focused in that area, putting out messaging and really trying to target, if you will, as much as we can, where we're seeing the problems. We've kicked out a lot of messaging around workplace exposures because we continue to see a lot of spread happening in workplaces. That is one benefit of the schools having been closed, is that hasn't had to be a focus for us. And so we haven't had to worry about that as much. We've engaged some stakeholders, some different community groups in the areas for putting messaging out. We've got billboards about to get plastered in a number of areas. The county is actually been working, putting a coalition together, if you will, involving tribal partners and other community members to really focus on the messaging aspect and get that out there. Because ultimately, all of this comes down to if people do not choose to follow the guidelines, if everybody can kind of look in the mirror, if you will, and if everybody does a little bit to get us in this direction, we can get the schools open. But if people choose not to, we're going to be doing online learning a lot longer than we would like to.
Thank you for your candor there. I think that helps kind of clear up what everyone's responsibilities are. And to that, I would just ask quickly, if people are in need of things like masks or hand sanitizer, are there places in the county that they can go that those are available to them?
So yes and no. So we do have supplies for all of those types of things. Most of our funding is designated at the response piece. And so if these are supplies that are going to be utilized in some aspect due to impact of COVID, either because somebody was a case or contacts, or there's a contacts in the workplace or in a school or something like that, that triggers our services being available for those types of items. Outside of that, all we can do is help connect you with and whoever else is out there. And we're usually pretty good about finding some of these people and making some of those connections.
Thank you, appreciate that. All right, our next question is around mental health. And Michaela, I think this one will be for you. Are there signs of mental health challenges that parents, caregivers, and spouses can or should be aware of? And then things that people can do in their everyday life to reduce stress. So that's kind of a two-part question, but I'll happy to give you part one and then repeat part two. And that first part is just kind of about warning signs, things to look out for.
Yeah, so warning signs are going to be, fairly standard that you might expect at other times as well. If there's changes in eating or sleeping, if there's changes in mood, if there's withdrawing, or on the flip side of that, it's always a continuum. So it could be way too much of something or completely regressing in something else. Another thing that some studies have shown is that in our younger kids, you might see some more clinginess. So kids might be really just glomming onto parents or caregivers or anyone in the family and just really needing that connection. With the really younger ones, you may potentially see some regression in potty training. So there could be some backsliding or there could be some accidents. Adolescents and teenagers, you could see what we don't want to see, but you could see it, is that more attention into the screen time and spending a lot more time interacting with people through video games, seeking out connection through chats. Unfortunately, that comes with some pretty significant risk. Not only is that not good for their eye health and their brain health and their social skills, but that also opens them up to some potentially dangerous situations online. And the FBI has actually put out some warnings about the risk of exposure to sexual exploitation through those platforms. So some things that are recommended would be, looking at the physical health opportunities to get out, take a walk, do some type of physical exercise, trying to maintain as a healthy of a eating pattern as you can. All of the whole health things that just lead to a better mental state with your kids, especially with the teenagers. If you're looking at that screen time diet, keeping them away from social media or having it be in limited opportunities. Same with the news. It's really overwhelming and it's really scary for any age right now to see what's going on online and what's going on in the news. It's not just the pandemic. We also have a lot of politics. We also have a lot of inequity that's going on. And so all of those things combined can be overwhelming for, again, any age, but especially for our adolescents and our children. So definitely trying to limit those opportunities, having conversations with your kids or your family about, what they can do, where you can connect, what the reality is of their situation, but trying to do that at an age appropriate level. I probably could keep going, but I'm now feeling like I'm starting to ramble. So, if you're ever in doubt or you're ever really needing some additional assistance because you've tried kind of the traditional methods of stress relief, reading a book, finding an activity to engage in, looking for games to play with the family, or doing some type of art for yourself, meditating, again, the list goes on and on. If you've exhausted those resources, then that's the time to really reach out for some help. Reach out to a warm line, reach out to a local provider, Lifeway's included, and get that connection to just kind of go through, this is what my situation is, and maybe this isn't a long-term mental health condition, but right now it's overwhelming my world and my family's world, and it's out of the ordinary, and we just need some guidance through that.
Thank you so much. So on that note, we know that, screen time is a challenge, and Superintendent Duff, we've had a question about career and technical education classrooms and what those might look like, as well as PE and some of those kind of non-screen activities that people are used to getting at school.
Yep.
In addition to sports, we've had questions about sports and what that'll look like. I'm sure that will come as no surprise to you.
All the things in my heart. I was a CTE teacher for over 8 years, so this is killing me with the CTE department. It makes it very hard to teach a student how to weld if you can't have them in there. And that's, I taught ag, so I taught all of those hands-on tools. I think we have, and I've seen CTE departments all over the state and nation for that matter. We have an unbelievable CTE department and offerings that other districts do not have. And I fully believe our CTE department will have virtual opportunities for students to be doing things. And then I also think that that's part of what, when I say we bring in small groups of kids, that may be something that we bring in is small groups of kids to do a welding, class for an hour type of a situation. But there's some really neat virtual things that I've seen just over the last month or two with some of the emails that I've gotten. And then I think those opportunities, we talk about PE and art. We are, when you look at those schedules that we have, especially at the elementary, it calls those out. We're going to have opportunities for PE and art. And those are, fun times. And I think those are great opportunities. I can tell you that last year in my house that PE was a big deal, and we had a kid that learned how to take his own heartbeat, learned about breathing, a lot of those things. There's a lot of things PE teachers can do virtually. I know one of the teachers had a journal, you had to go through and run sprints. You had to run around the house 3 times and then measure your heartbeat. So some things that have practical applications, I think that's important. So working through those, our staff recognize very much that it's not all math and reading. Those are important, but you'll see in the elementary time that they have community meeting time. That's for opportunities for students to share things. This is what's going on. This is a picture that I drew. Some of those fun times, maybe not so much academics going on there. And then like last year, we had mental health groups that got together, counselors met with students and they talked through issues. And just one tag on I'd say about that, and I've talked to some parents about this, is talk to your students or your kids. Kids pick up on you. So if you're stressed out and that's all they see, I can speak for myself. I had to check myself about 2 weeks ago, and I just had to say, hey, this is going to work out. It's going to be okay. It's crazy, right? Talk about all the crazy things that's going on, but this is going to be okay. You're going to be okay. Reassurance. A lot happens there. Now, I wish somebody could come across, and maybe I need to give a call, but could reassure me, but there's a lot of power in that, folks. There's a lot of power in your kids seeing that it's going to be okay, because they don't understand like us. We understand this is going to work out and we're going to be all right. But if they don't see that from who they're looking up to, that can cause a problem. Sorry.
I appreciate you adding that in there. It is such an important part of working with your family. So I completely back what you just said.
I didn't mess it up. That's good.
I saw Michaela nodding along as you were speaking. So folks, we're at 7:25 and I want to go ahead and kind of wrap us up so we honor people's time commitment. 90 minutes is a long time to be on Zoom. So I want to end by sharing 2 things from our attendees. We have learned that there will be a free COVID testing event in Milton Freewater On Sunday, August 23rd, that will be from 9 to 3 in the BMCC, so Blue Mountain Community College parking lot. It looks like there will be personal protective equipment, so masks available, food boxes, and some education on COVID-19. So again, that's Sunday, August 23rd in the BMCC parking lot from 9 to 3. And we'll push that back out through email as well so folks can see that in our meeting summary. And then also an update from Karen Hadeen at the YMCA. They are working with Erin every day to get this program up and running. And Karen shares that there will be more information hopefully next week. Their biggest priority right now is staffing. So they'll be getting those job openings up and providing information to the school district and the community about as many of the details as are available. And they will committed to getting you that information as soon as possible. So I want to thank everyone, our panelists certainly, but also our attendees. We really do want to recognize that so many of you are working on this, like I said at the beginning, both in your personal life and your professional life, that all of you are a part of solving and approaching these challenges. And it really is going to take cooperation and coming together and working together to get through this time, to support our kids, to support our families. And I also just want to acknowledge that tonight we've shared a lot of information and we've identified a lot of places where there's still things to be done. And this conversation is not the last one we will have. So, from here, there's certainly a lot of work to be done and a lot of room to come together to come up with some creative solutions. And we're committed to working as a community to get through these times. So we really appreciate our panelists and our attendees. And with that, I will let everyone get to their supper and hopefully their non-screen time activities. So thank you so much, everyone, for joining us tonight. And thank you. I want to say thank you again to Inez, who provided our interpretation. Such a valuable resource. So thank you so much, Inez. Really appreciate that. Have a wonderful evening, everyone.
Bye.